Dear students, when will you become a great physician or great clinician and work at the root level? There, sometimes you have to perform minor surgical procedure, that is suprapubic cystostomy, that is making an opening in the urinary bladder for relieving the pain arising due to the obstruction of the urinary output. Okay, so where will you insert your needle? To know that, you have to know the anatomy of the urinary bladder, isn't it? Okay, let's know about the gross anatomy of the urinary bladder. Here it is, our urinary bladder, and if we assume that this urinary bladder is of this individual, of this torso, where we will place it? We will place it in the floor of the pelvic region or pelvis, okay, like this, front part of the pelvis. This is the back side, okay, and here is the front side. So in the front part of the pelvis, just behind the pubic symphysis. This one is the pubic symphysis, and peritoneum is situated above the urinary bladder. This one is the cut portion of the peritoneum, okay, this one, okay, it is situated in the upper part of the or upper surface of the urinary bladder. That means urinary bladder is situated below the peritoneum. In case of male, just rectum is behind the urinary bladder, okay, but in case of female, between the urinary bladder and the rectum, the uterus is situated in this place. Clear? Okay, but this position is just for the adult. In case of the newborn, the urinary bladder remains as the abdominal organ. After 6 years, it descends down and becomes the pelvic organ. Okay. Now, before telling you the place of the suprapubic cystostomy, we will remove this bladder from here and we'll show you now the surfaces and borders of the urinary bladder first. Urinary bladder has 4 borders, 4 surfaces and 4 angles. What are those? This one is the apex of the urinary bladder, here, apex or anterior angle. This one is the neck. Here is the neck of the urinary bladder, this constricted area. Okay, here is the constricted area of the urinary bladder. This one is the neck of the urinary bladder. Okay, so from the apex up to the neck, this one is the anterior border. Here, okay. From the apex up to the opening of the right ureter. This one is the right ureter, and here will be the opening of the right ureter. Okay, and from the apex up to the opening of the right ureter, this one is the right border. So here is the opening of the left ureter. Okay, so if we draw a line from the apex of the urinary bladder up or anterior angle of the urinary bladder up to the opening of the left ureter, this will be the left border. Clear? So we have found the anterior border, right border and left border, also the anterior angle or apex and the neck, and this neck is the inferior angle of the urinary bladder. Okay, this constricted neck is the inferior angle of the urinary bladder. Okay, there is another border, that is the posterior border. Which one is the posterior border? This is the opening of the right ureter, and this is also called the right lateral angle, and here is the opening for the left ureter. Okay, and this is also called the left lateral angle. So from the right lateral angle up to the left lateral angle, if we imagine a border, this one is the posterior border. Clear? Here it seems that this one is the right and left lateral angle, but no, actually where the ureter opens at the urinary bladder, this one is the right lateral angle and here is the left lateral angle. Clear? Now come to the surface. Here this is the upper surface or superior surface, and from the anterior border up to here demarcated by the right lateral border, and this portion is the right inferior lateral surface. Okay, just remember about the surfaces of the pancreas. We have read their anterior superior surface, isn't it? Anterior inferior surface, but here the surface is oblique, so two terminology will come here. inferior lateral surface. Okay, right inferior lateral surface. And here this surface is also oblique, and this will be termed as the left inferior lateral surface. Okay, and here this portion just below the posterior border, this small triangular area where apex is directed towards the neck. Okay, inverted triangle from here, here and here. The apex is directed towards the neck of the urinary bladder. Okay, and the base, broader base is directed upwards, that is limited by the posterior border, and this portion is the posterior surface. Clear? Okay, we have found the posterior surface. We also call the posterior surface as the base of the urinary bladder. So we have found the 4 borders, 4 surfaces and 4 angles. Now in the examination you will be asked that which structure is attached at the apex of the urinary bladder, and you have to tell them that it is a true ligament, that is the median umbilical ligament, that is attached at the apex of the urinary bladder, and it is the remnant of the urethra. Okay. Now, which structures will open at the right lateral angle? Here, right-sided ureter opens at the right lateral angle. Which structure will open at the left lateral angle? Left-sided ureter opens at the left lateral angle. Okay? And then which structure will open at the neck or inferior angle of the urinary bladder? You have to tell that internal urethral meatus opens at the neck or inferior angle of the urinary bladder. Now from here I want to show you the peritoneal reflections. Okay, you are already looking that this area is smooth and shiny, okay, due to the mesothelium of the peritoneum. Okay, but here does this area shiny like this one? No. Here this portion? No. Here this portion? No. So we are looking that only the upper surface is covered with the peritoneum. Okay, and it is the visceral peritoneum. So what will happen here? This peritoneum completely covers the upper surface of the urinary bladder in case of male, and what will happen in female we will tell later. Just now look here, some portion of the peritoneum comes behind near the posterior border, okay, like this manner. During the reflection from the anterior surface of the rectum at the junction of the upper 2/3 and lower 1/3, okay, behind there is a rectum. So from here peritoneum will come here and then go up, then it will cover the upper surface, and anteriorly it will go towards anterior abdominal wall, okay, and on the right side also the abdominal walls also, lateral abdominal wall also. Okay, so the infralateral surface remain devoid of peritoneum here and here. Clear? When the peritoneum is reflected in this area between the rectum and the urinary bladder, then it will form a pouch. Okay, and the name of this pouch is the rectovesical pouch. Clear? Then how the peritoneum is reflected in case of female? Just look at here. Here, this is the female genital organ. Here is the external genitalia. This one is the uterus and other female genital organs, fallopian tube, ovaries, etc. Now this portion, just behind the symphysis pubis and in front of the uterus, this one is the urinary bladder. Okay, here is the peritoneum, and it is the rectum behind. Okay, very nice viscera. So peritoneum is reflected from the anterior surface of the rectum at the junction of the upper 2/3 and lower 1/3. From here it will go down and reflected at the posterior fornix of the vagina. Okay, and from the recto-uterine pouch. This one is the recto-uterine pouch, and you also call it the pouch of Douglas. Okay, this one is the pouch of Douglas. Okay, then the peritoneum will cover the uterus, come here, and here in the superior surface of the urinary bladder. This one is the urinary bladder. Here it will cover the anterior 2/3 of the superior surface of the urinary bladder, not completely cover the superior surface. Then go to the anterior abdominal wall and the lateral abdominal wall near the isthmus of the uterus. Okay, it is reflected anteriorly near the isthmus of the uterus and form another pouch. This is known as the uterovesical pouch. One deep pouch, it is the uterine pouch, pouch of Douglas, the most dependent part of the body during standing position, and here a shallow pouch, it is the uterovesical pouch. Now, when the bladder remains empty, it is tetrahedral in shape. Okay, the four surfaces are very clear, but when it is full of urine, then how does it look? It is not possible to push the water within this urinary bladder and show you the full bladder. So I shall show you in a model. Yes, when the urinary bladder is full of urine, then it looks like this ovoid shape, okay, or globular shape, okay. And you are looking that this one is the peritoneum. Cut end of the peritoneum are facing towards you, but these are non-peritoneal areas. Okay, these are the lateral surfaces. When the urinary bladder becomes full of urine and it cannot be drained through the urethra, then it will lift like this, okay, and become an abdominal organ facing the anterolateral surface towards the anterior abdominal wall, okay, and spilled off the attachment of the peritoneum from the anterior abdominal wall. At that time, you have to put your needle just above the pubic symphysis, and then no injury will occur to the peritoneum. Okay. Now we will see the area of the external trigon. Where it is located? Okay, you have already known that it is the visceral peritoneum. Okay, reflected part of the visceral peritoneum, and here is the peritoneal attachment line, isn't it? Just below it, it is non-peritoneal area, and it is triangular in shape from here up to the neck of the urinary bladder. This portion we have termed here a triangular portion as posterior surface, and the upper limit was the joining between the left lateral and the right lateral angles. Okay, but here the external trigon area is slightly above it, and it is related to the rectum in case of male. Okay, and in case of female there is no area of the external trigon because the peritoneum reflect somehow from this area. It does not cover the total upper surface of the urinary bladder. Now we will show you that which structures are related on the base of the urinary bladder. Okay, here we can see this one. This is one structure. Here is another structure. And this one is another structure, and this is another structure. And both are paired structures, isn't it? We have already known that this is the ureter, right ureter. This is the left ureter. Okay, and this one is the right-sided vas deferens. The right-sided vas deferens. What is vas deferens? We will learn it during learning the male genital system. And this vas deferens come at the posterior surface of the urinary bladder, just in front of the ureter, right ureter. Okay, and this one is the left-sided vas deferens. Okay, and it will also come in front of the ureter like this, and it is so long. It is as long as 45 centimeter. But here we cut the vas deferens in the right and left side, because while we remove the viscera from the cadaver, then the total vas deferens cannot be preserved. Okay, here this one is the right-sided seminal vesicle. Okay, and this one is the left-sided seminal vesicle, and this vas deferens will unite with the duct of the seminal vesicle and form the ejaculatory duct. Okay, here same thing happened. The left-sided vas deferens unite with the duct of the left seminal vesicle and form the left-sided is going to be that. I know that my students will also become a very good surgeon, very good urologist, and they will perform the retrograde pyelogram. So they have to know the interior of the urinary bladder, isn't it? I have cut the lateral, left lateral border of urinary bladder and flip the upper part and opening the interior of the urinary bladder. Okay, here is the interior. Okay, this is the posterior aspect and it is the anterior aspect. This one is the interior of the posterior surface and it is the front side, and this is my urinary bladder. So I am looking at my urinary bladder. Always think that you are looking at your urinary bladder. Okay, this one is the back side, here is the front side. In the living, the mucous membrane of the bladder is smooth and pale in color. Here in the cadaver, you are also looking that the mucous membrane is very smooth. Okay. It is very loosely attached to the submucosa, hence it is thrown up in fold when the bladder is empty. Okay, when the bladder becomes empty, just look at here, like the lax skin, you can hold the mucous area. Okay. Okay. Now we will learn about the internal trigon. The internal trigon is a triangular area on the posterior surface of the bladder. Just I am showing you the posterior surface. I am holding the two ureters. Okay, this one is the posterior surface. Okay, now look at this is the interior of the posterior surface of the urinary bladder. Okay, okay. When here the mucosa is pink in color and is firmly attached to the underlying muscle layer because the submucosa being absent at internal trigon. Here in this area you cannot lift up the mucosal area because it is firmly attached. Okay, and you cannot differentiate the color because it is not the living body. It is the cadaveric viscous. Okay, okay. But here the mucosa is lax. Okay, but here it is firmly attached under the underlying structures or muscle layer. There are no submucosa is present. It is shaped like an equilateral triangle. What is equilateral triangle? It means the arms of the triangles are same. Okay, here equilateral triangle. The length of this line is equal to the length of this line is equal to the length of this line. The interuretary ridge of Mercier, which is formed by the fibers of the inner longitudinal muscle coat of the ureter, forms the upper margin of the trigon. Okay, actually it remains in this position. Okay, so we are make it flat. Actually this is our upper area. So this upper area is formed by the interuretary line. Here can you see one opening? Here is the opening of the right ureter and here is the opening of the left ureter, and this interuretary line will form the upper margin of the internal trigon. Okay. Interuretary crease is seen as a pale band through the cystoscope and acts as a guide for the surgeons to identify the ureteric orifices through which sometimes the ureteric catheters are introduced for retrograde pyelography. And the other two sides of the trigon are formed by urethral betas, and that is also formed by the longitudinal muscle of ureter. So from the name we can trace that from the opening of the right ureter, it is the internal urethral betas. So this is one line, urethral betas. Okay, here this is not the depressed area. I just put a line here, a very faint elevated area is seen. Okay, it is the urethral ridge, right side, and on the left side also there is another urethral ridge, very faint urethral ridge. Okay, and here is our internal trigon, and the orifices of the two ureters. Here is one orifice, here is another orifice. These orifices will form the superolateral angle of this trigon. Okay. In male, the internal urethral orifice is guarded by an elevation. This one is the internal urethral orifice, and it is guarded by an elevation of the trigon called the uvula produced by the projection of the median lobe of the prostate. if we feel here, you can feel that an elevated area is situated here. Okay, this one is the uvula vesicles. Okay, here you cannot feel such type of feeling on other sides, but you can feel that here something is present under this. Okay, here is the median lobe of the prostate is situated here. When this median lobe enlarged, it will come over the internal urethral meatus and block the drainage of the urine. When the individual gives strain to passing out the urine, then it will more deeply or more firmly block the opening of the internal urethral meatus. That is usually happen in case of the benign enlargement of the prostate. Okay, it is the story of this hollow muscular organ which acts as a reservoir of urine that bring to it by two ureters. Okay, now at last but not the least, here at the neck, just below the neck, this organ, this muscular organ is a gland. In case of male, it is prostate, but in case of female, no prostate gland is present, no seminal vesicle is present, no ductus deferens is present. Okay, but in case of male, at the neck of the urinary bladder, okay, there will be a prostate, there are two seminal vesicles, two ductus deferences. Okay, but two ureters will be present in both sexes. Just look in the sectional view again. This one is the rectum, anal canal. Here is the uterus. We will learn it later. This one is our urinary bladder, isn't it? Okay, and here is the pubic symphysis. Okay, so this is the urinary bladder in female, and there is no prostate, no seminal vesicle, no ductus deferens here. Okay, just very short urethra opens at the external urethral meatus, and here is the internal urethral meatus. Clear? This one is the recto-uterine pouch, and it forms at the posterior fornix of the vagina. But here, this one is the uterovesical pouch formed at the isthmus of the uterus. Okay, upper surface of the urinary bladder is not completely covered by the peritoneum. Clear? But in this case, here, this one is the rectum, and here is the anal canal. This is our urinary bladder, and this is the pubic symphysis. And here no uterus is present, so it is the urinary bladder of the male. Okay, and just below it, this gland is the prostate, this one, and here the right seminal vesicle is seen, and here vas deferens and ductus deferens is also seen here. And here this is the rectovesical pouch. Now I want to tell you about the retropubic space or cave of Reitzius. From the name we can find out the space. This is the pubic symphysis. So this space is known as the retropubic space. Okay, this is the pubic symphysis. Here is the retropubic space. Clear? And it is named after the name of the scientist Reitzius. The retropubic space or cave of Reitzius, with its pad of fat, separates the inferior lateral surfaces from the pelvic surface of the pubis and puboprostatic ligaments. On a slight posterior plane, these surfaces are in contact with fascia covering the levator ani and obturator internus.